Breaking news as thousands of healthcare servicers, providers, and nurses are laid off. Now, some would blame that on the plummeting birth rates. Others would blame that on senior citizens not being able to afford proper care. But others would also say that the reason for the layoffs is because the medical system is absolutely destroyed and a dumpster fire. Whether that dumpster fire was created from the greed, corruption, fraud, or the Federal Reserve could be anyone's guess. But either way, you guys, I have Jack with Nobody Special Finance here to try to help us figure out what's going on and whether or not that this can get worse. And if you guys like what he has to say, come on over to his channel right here on YouTube, Nobody Special Finance. This is my buddy right here. And you guys, we are doing a video to accompany this video on his channel with Stewart Healthcare. So when you're done watching this, definitely go over to his channel and check that out. And before I begin and before we jump into these recent layoffs, Jack, how are you, sir?
I'm doing excellent, Travis. Thank you again for having me on. And thanks for telling me about this story. We found some cool stuff while we were digging around in this yesterday.
Yes. Some interesting questions like birth rates, senior healthcare expenses. I thought it was greed, corruption, fraud. I mean, what the heck is going on? Let's look at a few of these headlines announcing thousands of layoffs. Struggling CarePoint Health could lay off 2,600 employees, which is obviously a ton of employees. When we go down, because I'm more interested on why the layoffs, but a little bit of a backstory. CarePoint Health could lay off more than 2,600 employees effective December 12th, according to notices filed with New Jersey regulators this week. The proposed cuts would impact workers across 3 different hospitals. So this is impacting 3 hospitals, 859 workers at the Bayonne Medical Center, 843 workers from the Christ Hospital in Jersey City, and 900 workers from the Hoboken University Medical Center. Now, a spokesperson for CarePoint said in a statement that the 3 local hospitals, and this is what I'm interested in, are not facing any imminent threat of closure, and no final decision regarding layoffs has been made at this time. Now, they go on to say essentially that the reason for these layoffs, Jack, is because of daunting financial challenges. In addition to that headline, this headline states Stewart Healthcare will lay off more than 1,200 workers in Massachusetts. The bankrupt health system will lay off workers at the end of the month as it prepares to close 2 hospitals in the state. So this one is noting hospital closures. One bullet point right here. News of the cuts come just a day after a federal court approved Stewart's plan to close the facilities, which Stewart said are losing money and have low patient volumes. Stewart attempted to find a buyer for the hospitals during a months-long marketing process. However, the system said it received no qualified bids for the properties. Before I go back to you, Jack, Texas Children's Hospital to lay off 1,000 workers. That is a massive amount of people, you guys. 5% of workforce. Couple of the bullet points here. Despite being a nonprofit, the renowned Houston-based, that's my local city, Houston-based hospital, which is affiliated with Baylor College of Medicine, has found itself in a financially challenging situation. Full details about the financial impact have not been disclosed. Here's what has been announced. The hospital, which operates in 120 locations across Texas and globally with a primary presence in Houston, employs approximately 20,000 people. Now, Houston Children's Hospital has attributed the need for layoffs to a combination of factors like low patient volume, again, financial challenges, and number 3, delay in opening a new Austin campus. Jack, having read that, what do you believe some of these financial challenges and daunting financial obstacles that they're facing? And do you think any of these hospitals are at risk of being completely shut down?
So let me address the last part. Absolutely. I think a lot of hospitals are at risk of being shut down right now. We're actually seeing a lot of hospitals, especially in Massachusetts, have been shut down just in this last year because of Stewart Healthcare, one of the names that you mentioned there. Now, it's interesting. Let's talk about these 3 because you talked about CarePoint in New Jersey, you talked about Stewart Healthcare, and then you talked about Texas Children's Hospitals. Let's talk first about Stewart Healthcare. We've covered this one on DNN quite a lot. You, me, and Melody over there, we've talked about this one. If we could share my screen there. The daunting financial challenges facing Stewart Healthcare, I think, has less to do with things going on in the medical community and probably more to do with this picture here. This is CEO Ralph De La Torre's $40 million yacht that he bought shortly after Stewart Healthcare signed a massive sale leaseback agreement with a real estate investment trust called Medical Properties Trust, or MPW is their stock ticker. Now, Medical Properties Trust now owns the buildings, and Stewart Healthcare rents the buildings. So they sold the buildings to them for millions of dollars. The ownership of Stewart Healthcare paid themselves hundreds of millions in dividends off of that sale, which, of course, tens of millions went to buy Ralph De La Torre's yacht here. And ever since then, all of these hospitals that Stewart operates that are owned by Medical Properties Trust have been going bankrupt. Because where the hospital used to own the building outright, now they have millions of dollars a year in rental payments that they have to make to this real estate investment trust on top of their standard operating budgets. And so these hospitals have just slowly bled to death after being strip mined and looted by Stewart Healthcare's management in a sale leaseback agreement. This is a very common strip mining, looting, predatory tactic that private equity firms use. This is the same thing that's bankrupted Red Lobster, besides Red Lobster's disgusting food. But they passed a big sale leaseback agreement with their franchises, and one by one, Red Lobster restaurants have gone belly up. So as far as Stewart Healthcare, there's no outsized medical thing happening. They just looted the company, and now they're going bankrupt. And by the way, the Stewart story, they don't have any money to pay their vendors. They're not paying their doctors, but they do have millions of dollars to hire private intelligence firms and spies to conduct false flag operations against the short sellers that are targeting Medical Properties Trust. That's something we've also talked about on DNN, and I have something coming out on that topic shortly on my own channel. So that's Stewart Healthcare, all right? Now, before we started recording here, I had actually never heard of the CarePoint story. It's funny you should mention that. But while you were talking, I did some quick digging into CarePoint, and I found this article in NJ.com. CarePoint Hospital issues 2,700 layoff notices. Now, this is from 2019. This story is a few years old, but looks familiar, right? Layoffs at CarePoint hospitals. And it's funny you should mention Stewart Healthcare and CarePoint, because as I read through this article about all the financial troubles at CarePoint hospitals, I came across this, besides the stupid pop-up that I'm going to close. When CarePoint Health purchased HUMC, which I believe is Hoboken United Medical Center, they also purchased the Christ Hospital and the Bayonne Medical Center in 2011, the same hospitals you just mentioned about the layoffs. It sold Hoboken and Bayonne properties to Medical Property Trust of Alabama in a leaseback deal. The same exact corrupt sale leaseback thing that Stewart Healthcare did with Medical Properties Trust that has bankrupted their hospitals. This CarePoint outfit in New Jersey did the same thing with Hoboken and Bayonne properties. So now they're having to pay these big rental payments on top of their operating budgets, and they're just slowly bleeding out cash until there's nothing left. And the executives at CarePoint, I'm sure, paid themselves handsomely for that deal. Meanwhile, doctors, nurses getting laid off. So that's CarePoint. Now, the third one that you mentioned, Texas Children's Hospital, that one is a little different because that one wasn't bought out by a private equity firm. There was no sale leaseback agreement involved there. But that doesn't mean there's nothing suspicious going on there. And I found this one in the Loan Institute, Hospitals Behaving Badly, UPMC and Texas Children's Spending Draws Scrutiny. And the interesting thing here, because Texas Children's Hospital, they're laying off 1,000 nurses, right? Well, when you scroll down here in this article, they say Children's Hospital layoffs. UPMC, not the only hospital receiving attention for layoffs amid high CEO pay. Texas Children's Hospital, nonprofit, announced last month that they're laying off 5% of their workforce, estimated to be about 1,000 people. They're saying they're reducing their executive leadership team and plan to cut executive compensation this year. Of course, that's a good course correction, but too little too late, because their CEO, Mark Wallace, he paid himself $8.8 million in 2022, the most recent data we have available. This nonprofit children's hospital, the CEO is making $8.8 million a year, and they're laying off nurses. About 4.7 million of that compensation was bonus and incentive pay. I don't know what bonuses and incentives they're triggering that are resulting in millions of dollars in payouts for the CEO, but they can't be that hard to hit if they're laying off 1,000 people while simultaneously meeting these bonus milestones. But the thing that really jumped out at me, Travis, and I could not believe this when I read it, the hospital has committed $65 million to be the title sponsor of the Houston Open Golf Tournament. It's part of an effort to grow its regional, national, and international brand, according to the CEO. All right, now, okay, first of all, $65 million to sponsor a golf tournament. What? $65 million? These golf tournaments are cleaning up. But what do you think is more important to this nonprofit hospital? Treating children, having doctors and nurses on staff, or growing the regional and national, international brand via golf sponsorship? That's what I don't understand. How could they possibly argue that there's any kind of a return on investment in this $65 million in ad spend on a freaking golf tournament? And I kid you not, here's the website for the Houston Open. And there it is in the upper right, the Texas Children's Houston Open. Oh, we got a countdown. It's in 180 days. And there's their logo again. So, maybe we'll just explain that to the kids with cancer at Texas Children's Hospital. Sorry, guys, we don't have any nurses. And, it's going to take longer when you hit that bell for a nurse to show up and see what's bugging you. But you can rest easy in knowing that the golf tournament is being sponsored and they're raising brand awareness.
Okie dokie. Well, I would say you answered the question. It sounds like, I would say.
Did I ramble?
No.
You
answered. No, I was really surprised about CarePoint. That was actually a shocker. I didn't know that. But I mean, essentially what you're saying is, well, first of all, with Stewart Health, CEO spending. The CEOs are spending crazy. They're spending money on yachts and spies. CarePoint, the CEOs are investing poorly. Obviously, hospitals are being closed down. Texas Children's Hospital, the CEOs are spending $65 billion on golf tournaments. What about all the bonuses from the CEOs? I mean, my gosh, man. Yeah, you answer the question. But, what I want to do now is I kind of went down a rabbit hole and I wanted to see, what is not in the headlines per se. So I accessed the most recent list of warn notices, and going down that rabbit hole, it led me to a couple interesting opinions on why some of these layoffs may be happening. Take a look, Jack. Starting with the warn notices, the most recent notices, actually, a couple of them are in healthcare services. The first one is 12 Oaks Foundation, which is senior living. The other one is USC Vertigo Hills Hospital. Now, what's interesting, Jack, is they're actually both in Los Angeles County, which was, I was like, oh my gosh, this is spreading. And I want to note real quick, as far as the USC, they're announcing a permanent closure, and the 12 Oaks Foundation up here is announcing permanent layoffs. Now, when I searched the news media, here's what I found. Starting with 12 Oaks, this is very interesting. So 12 Oaks to shut down for construction. So they're saying construction. The well-known senior living facility is a unique oasis in the community surrounded by trees and pathways. This is an area with individual rooms and throughout the property, small cabin-type residential buildings. All of the buildings will be knocked down and a new facility built from the ground up. The city of Glendale wants all utilities underground. So essentially, this has been through a roller coaster. They're saying these layoffs is because they're doing construction. Again, I'm wondering, why would they say the layoffs are permanent? Either way, it brought me to this next article, which is very interesting. This is on USC. You could track these layoffs. These layoffs are literally spreading, but this one's interesting, Jack. This is an opinion. Why are so many California hospitals closing their labor and delivery units? Just one paragraph here, Jack. Last week, Keck Medicine of USC announced the closure of USC Vertigo Hills Hospital services. They cited listen to this is insane. They cited a 40% decline in deliveries over the past decade. Now, this is within their community, and the resulting financial effect on the hospitals as a reason for the decision. While this justification appears reasonable at first glance, it conceals an unsettling trend with significant implications for maternal health. Jack, after reading that, after a couple of points that they brought up, do you think that we could say at least a portion of the layoffs are attributed to any massive decline in birth rates, or the fact that maybe senior citizens can't afford to get proper health care? Any merit to either of those two things?
On the seniors not being able to afford health care, I'm a little hesitant to jump into that. The demographics alone in the United States with the aging population, I think, is enough to support the construction and the expansion. Honestly, I think the story about knocking down those small cabins, I think they're going to build a giant multi-residential monolith structure in there with smaller rooms so that they can cram even more people in there and milk the property for more money. That's just my uninformed guess at what's going on there. I'm having a hard time believing that it's for lack of demand, lack of affordability. There may be some truth to that. I think that's very real. Now, the issue about the declining birth rate, that is absolutely a thing. The birth rate in the West, really the whole global North, right? All of Asia, Europe, and North America, the birth rate has been well below the replacement rate for several years, including here in the U.S. The hospital I was born in and where my oldest daughter was born, shortly after my oldest daughter was born, they shut down their maternity ward. And, my youngest had to be born in a different hospital because of that. We're just not having enough babies. And so, hospitals that provide that service would be going out of business as there's just not enough babies being born to keep that staff there. Now, all that being said, the phrase is when the tide goes out, you find out who's been swimming naked, right? So you could argue the rising unaffordability in healthcare and the decline in the birth rate, that could be the tide going out. But that is not solely responsible for all of these layoffs and all of these hospitals being shut down. The problem is management has been swimming naked in the form of these sale-leaseback agreements and the tens of millions for golf tournaments. And those last few that like USC, I haven't studied those in particular, but I'm sure if you dug into the books, you're going to find gross excesses among the leadership teams. You're going to find cash burn that made no sense, if not someone outright looting the facility. So, I think you probably have the tide going out and you've got some people swimming naked there.
Yeah. Do you think the 40% decline in births, do you think that's just an outlier? Or do you think that's, because that seems high. Am I wrong? Over the last decade, 40% decline? Do you think that's an average?
Over the last decade, that might be a bit excessive, but over the last several decades, I think that's probably accurate. We're only having something like 1.7, 1.8 children per couple in the United States right now. The replacement rate is 2.1, 2.13, something like that. So, we've been well below the replacement rate for years here, and it is declining. That number may be a little aggressive, but I think it's at least in the right direction.
All right. Let me take the viewers now, Jack, to the most recent nationwide mass layoffs in healthcare nurses, service providers right now by accessing this article. This is from fiercehealthcare.com. This is very interesting. This is a tracker, Jack. So I will have the links to all of this if you guys want to track. This is updated as of a couple days ago, September 23rd. Now, again, they're doing a tally of layoffs across the industry. So this is one of the only ones I've seen that is actually tracking this, Jack. But it's going to start by talking about Lifespan has confirmed strategic restructuring that has trimmed 20% of its executive positions. Get it, Jack? And that's going to save them $6 million. It goes on to talk about Optum in Baskin Ridge, New Jersey, laying off 160 workers. That's in addition to about 524 workers in California. So that's just a part of what's going on there. Also, here's CarePoint Health. We talked a little bit about that. Massive layoffs with CarePoint, 2,600. We have here Samaritan Health Services confirmed it reduced its workforce by 80 positions in light of a variety of pressures, including inflation, cyber incidences, which is interesting, weather, a decline in volume in some clinical areas, and unfavorable payer reimbursements. And that's only 1% of the 5 hospitals in Oregon that they operate. This goes on to Southwestern Health Resources has laid off 129. Kaiser Permanente actually will be closing an entire facility, a nursing home, massive nursing home with 249 layoffs. This is saying a steady decline of patients, but the underlining thing here is a shift to home-based care. So that would suggest, in my opinion, Jack, that is an affordability thing. But again, interesting that an entire facility that is in senior care is being shut down. Now, here's another surgical hospital being shut down. They're laying off about 160 employees. Another place in California, Modesto, California, very interesting. Blue Cross Blue Shield of Michigan laid off 64 workers as well, citing industry-wide cost pressures from drug claims and medical care fraud. I'm just kidding, Jack. It does not say fraud. It says medical care utilization. I added fraud because that's what's going on behind the scenes. Here's Texas Children's Hospital mentioning again the 5% of the workforce being laid off, totaling about 1,000 jobs. Here we go as well with health plans on 171 worker layoffs in North and South Carolina. We have New York's Garnet Health with 26 employee layoffs. Ohio University Hospital plans on 300 job cuts. Goes on to Oregon Health and Science University with 500 employees over the next few months. That's a lot of people, guys. Cigna layoffs in Arizona totaling about 261 employees. Obviously, Jack, all of those layoffs are going to drastically impact the localized community in multiple different ways. But my question to you, sir, is what do you think is happening? Do you think it's 100% the result of the CEOs, that greed, manipulation, and fraud? Do you think maybe it's the Federal Reserve? What's happening? And do you think specifically in healthcare services, nurses, providers, do you think the layoffs are going to get worse? Why or why not?
So 100% responsible due to greed, corruption, fraud? No, I don't think it's 100% responsible. Now, you touched on a lot of different things there, right? The healthcare industry is huge. You've got emergency care, you've got long-term care, you've got insurance, you've got medical devices. All right. So we're talking a pretty big field of different technologies and different jobs there. The Blue Cross Blue Shield layoffs, talking about higher utilization. We have seen trends of that in the stock market. The insurers have been under pressure because a lot of people put off a lot of elective procedures during the vid. They didn't want to go to the hospital and get sick, so they put off that hip replacement. They put off a lot of things that maybe they would have had done if there wasn't this pandemic going on. And then now that the pandemic is over, everybody is going and getting this done at the same time. And that has resulted in a very sharp year-over-year increase in the demand for health insurance services. And so Blue Cross Blue Shield is responding to that with layoffs. That's not terribly surprising. The nursing home thing and the transition to home care, I think you probably got a little bit of, again, vid hangover going on there. Nobody wants to put mom or dad in a nursing home, not after seeing what happened in 2020. I mean, nursing homes were ground zero. They actually sent patients with the disease to the nursing homes where they were surrounded by the most vulnerable segment of the population in close quarters. So would you want to leave mom or dad in a place like that now, having seen what happened in the earlier part of this decade? I'm not surprised they're seeing a transition to more people opting for home care. I plan to do the same thing when it comes to my parents. So, you have things like that are happening within the sector. But at the same time, one of the ones that you said there was announcing a lot of layoffs was Optum Healthcare, right? Optum is owned by United Health. Take a look at United Health stock over the last year, over the last 5 years, over the last 25 years. And if you're trying to tell me this is a company that is seeing dire financial situations and that they're having trouble now, financial things beyond our control, how do you explain that and the stock performance? You can't. United Health has been growing like gangbusters. They are making money hand over fist in every angle of their business. The problem is, where is the money going? The money is clearly not going to the doctors. The money is clearly not going to the nurses. And the money is going to the executives. It's going to the shareholders. It's going to the venture capital firms, the private equity firms that are looting these hospitals. Right? The executives who right now are crying poverty are doing so from their magnificent mansions and magnificent yachts. These guys have strip mined these facilities. They're making money hand over fist. The quality of care has declined. Anybody who has had any interaction with the healthcare system in the last few years will tell you, you got to take a machete and hack your way through 15 different bureaucrats and administrative know-nothings before you can even get to a care provider, even a nurse. And if you're lucky, you probably want to be able to see a doctor. Maybe you see a nurse practitioner. But the quality of care is falling. The cost of the care is rising astronomically. And the people that are making the money are not the care providers. It is the executives who are standing between the patients and the providers. And I think that is probably really the root of what's going on here. And now, instead of some kind of hard look at the way we're managing our healthcare system and the role that these leadership teams are playing and maybe adjusting our policy accordingly. No, we're laying off nurses. We're laying off doctors instead of them. That's disappointing.
Of course it's disappointing. I mean, do you see it getting substantially worse? Or you see maybe a steady decline in layoffs, or do you see it collapsing straight up?
It's currently in a state of collapse, and the Stewart Healthcare story is by far the most grotesque example of that. Several hospitals have already been shut down. Several more are about to be shut down. There's this legal battle is going on right now. Is the government going to step in and bail out these hospitals? Well, if they do, then they're just essentially incentivizing further fraud and further strip mining of hospitals. If they don't, the communities are going to lose these hospitals. The government can't just come in and seize them. It's private property. They can't do that. So until we see how the Stewart Healthcare collapse and the bankruptcy is going to play out, and God willing, Ralph De La Torre in handcuffs, as I think he belongs, until we actually see that, then this collapse will continue, because right now there's only incentives. There is no deterrent to this behavior.
In other words, then it will continue to collapse. And also what we really need to do is overhaul the entire medical system and stop CEO spending. I mean, we need a T-shirt that says "Stop CEO Spending." Seriously, that would be a pretty appropriate T-shirt. One question, Jack: yes or no? Now, you made a comment earlier. You stated, let me see right here. You said that Red Lobster has disgusting food. I just wanted to ask you: are you talking about the Red Lobster biscuits as well, or would you exclude the biscuits? Because some would take offense, including me, with that statement.
Okay, maybe the biscuits are good. So, while you're at a collapsing Stewart Healthcare facility getting your stomach pumped, maybe you want to hang on to the biscuits while all that other rotten stuff is extricated from your lower intestines.
He makes some compelling arguments with the Red Lobster biscuits. Cholesterol being one of them, he should have injected. But again, you guys, I want to remind you, Jack is working on a banger story with Stewart Healthcare. The link will be in the description. But Jack, go ahead and announce what this next video on your channel is about exactly, sir.
So it's about Stewart Healthcare, one of the companies that we just talked about today. And it's about their multi-million-dollar false flag operation where they hired a private intelligence firm in order to create fake false flag attacks against a short selling firm that was targeting Medical Properties Trust, that real estate investment trust that is also bankrupting CarePoint along with Stewart. But the actual person that they hired, this is what blew my mind about this story. If you've been paying attention to politics for the last few years, the name of this spy that they hired will probably sound very familiar to you. You do not want to miss this story. It is unbelievable how corrupt these people are.
It's a well put together story, a lot of investigation, a lot of insight. You guys should be able to click the link on the screen to watch that video, and we wish you guys an absolutely great evening.